Good evening. You're watching the Policy Times exclusive show, Global Unleashing India Global Web Summit Series, Post-COVID Devastation. पिछले कुछ महीनों से अंडर द चेयरमैनशिप ऑफ डॉक्टर पी शेखर, जो एक बहुत ही रिनाउंड थिंकर हैं, एंटरप्रेन्योर, पॉलिसी मेकर, ऑथर, और अलग यूनिक तरीके से देश के डेवलपमेंट में अपना कंट्रीब्यूशन करते हैं, उन्हीं की चेयरमैनशिप में हमने ये शो शुरू किया और आज ये करीब 60 के करीब एपिसोड्स हैं. So we have brought the best people from different sectors to share their views on the idea of nation building. Now that idea of nation building is converted to national reincarnation, क्योंकि कोरोना क्राइसिस पूरी दुनिया के सामने है और ये क्राइसिस दुनिया को दो हिस्से में बांटा है. ये जो पोस्ट कोरोना पीरियड है वो कैसा होगा, ये हम पता करने की कोशिश कर रहे हैं हमारे इन एपिसोड से. और हम किसी पॉलिटिकली मोटिवेटेड और उस तरह से एक्सपर्ट्स को नहीं बुलाते. वी ब्रिंग द पीपल फ्रॉम द रियल ग्राउंड हु आर वर्किंग ऑन द ग्राउंड टू ब्रिंग चेंज एंड डेवलपमेंट इन द सोसाइटी. आज भी अगर आप देखें, ये कोरोना क्राइसिस जो है, सबसे बड़ा मुझे लगता है कोरोना क्राइसिस दुनिया के मेडिकल या हेल्थ केयर सिस्टम के टेस्टिंग के लिए था, कि दुनिया के हेल्थ केयर सिस्टम कितना फिट है, कितना कॉन्फिडेंट है और कितना इफेक्टिव है. उसका सबसे बड़ा नजारा हमने ये कोरोना क्राइसिस में देखा. और ये एक दिशा हमें ये भी दिया कि किस तरह से कोरोना जैसे बीमारी भी आ सकता है और इसको लड़ने के लिए किस तरह से हमारी प्रिपेयर्डनेस भी उतना ही मजबूत होना चाहिए. कोरोना इज जस्ट वन फेस ऑफ इट. पोस्ट कोरोना इस तरह से पता नहीं क्या क्या आएंगे और किस तरह से हमारे मेडिकल सेक्टर उसको कोप अप करेंगे, उसको अडेप्ट करेंगे और उससे फाइट करेंगे, ये देखने का है. और फाइट करने का जब सवाल आता है, सबसे बड़ा चीज जो होता है वो है इनोवेशन. ये बड़ी इंटरेस्टिंग है. इंडिया आज पूरा ग्लोबल फार्मा हब है. हमारी सक्सेस जो है फार्मा सेक्टर में अनपैरेलल है दुनिया के. सिमिलरली हमारे जो डॉक्टर्स की कंट्रीब्यूशन है वो भी अनपैरेलल है. दुनिया की किसी भी कंट्री में इंडियन डॉक्टर्स आर फार फार मोर सक्सेसफुल. चाइनीज जो हेल्थ केयर सिस्टम या मेडिकल सिस्टम है उसमें बहुत ही अनकंडीशनल और अनकॉम्प्रोमाइजिंग सैक्रिफाइस और कंट्रीब्यूशन है इंडियन हेल्थ केयर और मेडिकल एक्सपर्ट्स का. हेल्थ केयर एक चीज है लेकिन मेडिकल एक्सपर्ट्स की दूसरा है. आज हमारे साथ दो बहुत ही इंपॉर्टेंट एक्सपर्ट हैं मेडिकल इंडस्ट्री के, और वी विल हियर फ्रॉम देम हाउ मेडिकल इनोवेशन और ग्लोबल medical innovation strategies are needed and what role they will play now as the vaccine is also around the corner. हर कंट्री ने अलग अलग तरीके से अपने तरीके से वैक्सीन बनाया है. पोस्ट कोविड वैक्सीनेशन कैसे होगा, इसके बाद क्या सिनेरियो होने वाला है, पूरा इसके ऊपर पूरा चर्चा करेंगे. हमारे साथ मैं थोड़ा सा स्पीकर को इंट्रोड्यूस कर दूं, फिर डॉक्टर पी शेखर भी इंट्रोड्यूस करेंगे. ऑफिशियली डॉक्टर समीर शाह जी हैं हमारे साथ, फाउंडर है ग्लोबल लाइफ साइंसेस एंड हेल्थ केयर फोरम, रेडियोलॉजी एक्सपर्ट हैं और उन्हें बहुत सारे पेपर नेशनल इंटरनेशनल कॉन्फ्रेंस में प्रेजेंट किया है और लिखा है. हमारे साथ एक और बहुत ही इंपॉर्टेंट मेहमान वी हैव विद अस डॉक्टर बी नतेश, हु इज एन इंटरनेशनल हेल्थ केयर एक्सपर्ट एंड इंटरनेशनल हेल्थ केयर एंड मैनेजमेंट एक्सपर्ट with very specialization in artificial intelligence driven manage healthcare management system. इसी के साथ मैं डॉक्टर शेखर को रिक्वेस्ट करूंगा आज के शो की शुरुआत करें. Dr. Shekhar, over
Thank you, Akram. Like Akram said, today is almost the 60th show, and we started it on a very casual basis in May, and it has gone into a very serious and very synchronized syndrome. So much so that today, very people even at the ministry level come and ask us when they can come on the show. And we have got extremely good experts from various sectors, and we are making it on a very simple and simplified basis. Each sector will try to see how they can contribute for the national growth. Now, national growth has been renamed as national reincarnation, and the word national reincarnation only implies that there is something wrong. However positive we may want to be, there's something wrong. And in the wrongness, whatever are today's experts are some people who are responsible for making it right. Okay. For this, I have to very personally and otherwise congratulate even our today's experts, because today medically India is the best in the world. Till few, whether anything has happened or not happened, India has proved itself to be the best in the world. No country today's death rate in USA, which USA has got 1/4 of India's population. Today it is 3,000 there. Okay, and India is standing around 350. That itself shows that India, by any normal numbers, people say that US health system is very good, we should follow it, we should do so many things. I'm not criticizing US system, please, but we are no second to anybody. Second thing about today's experts are India was left in the lurch by British in 1947 with an average age of only 27. Today we are 64 plus plus plus. It is growing. We are refusing to die because of the healthcare, because of the way the healthcare professionals have taken care of all Indians. So with that, I will just rush through a small presentation. Today's, can you load the presentation?
Yeah, it's there.
Yeah.
Dr. Shekhar. The
Yeah.
presentation is on.
Today's topic is, of course, as we say, global medical system for powerful healthcare. Now we have the first slide in which we talk of India as a country, so that we understand that we as a country are a very complex country, and because we have population, by population we are almost 206 countries put together, and we got land which is almost 3.3 million square kilometers, and we only use 0.4% of the land. We have got enough water, but yes, like in this thing, we got water in a wrong place and free land in a wrong place. And so our development is always on this. Now, coming quickly to COVID cases, COVID has come as a absolute disaster for the whole world. Okay. Nobody can say, even the most of the optimistic places, the way we are, we can say COVID is an invisible item. It has also affected an invisible number of people, but it has brought so much fear. And it has made the life of the people, professionals who are sitting in front, so horrible. I know they are at the call and mercy of all the fear. And like some of my doctor friends say, even if nothing is there, I can't say nothing is there, because people feel I am not doing justice to my post. So they have to somehow treat them, bring them confidence. It has psychologically, morally, ethically, I may not say, economically, it has totally devastated the people. And yes, we are, with all this thing, we are still best in the world. And our numbers say that with 1.4 billion people, total number of deaths, total number of these things are all meaninglessly low. Because any day, anyway, 27,000 Indians die in normal process. Today, maximum one has died at the peak of COVID is also something like 1,100. So that which is almost 4 to 5%, which is the error factor. Now, let us say why we are talking of what we are talking. We are talking of, with two experts, they'll be doing the main talk, but we'll run through certain slides so that to give a feel of what we are going to say, because health is a very complex item and health has got its own requirements, its own way of analysis, because health consists of everything in the body, right from a brain to the foot. And so any item can have its own complexity, and we can have 20 such seminars and it may not cover. If I just say head can have so many. But here we are talking of a holistic health. Here we are talking of the way holistic health, how it can take care, and how we need not have to take only one type of remedy or one type of action. We have got Ayurveda, we have got allopathy, we have got so many, homeopathy, and we got our grandmother's treatments. They are all actually good. That is why we are whatever we are. Others we used to generally shun, thinking that our own grandmother's treatment are not very good, but they are also good. That's why we are whatever we are. So, and health comes in many. I think one is preventive, one is actual treatment, one is post treatment. And health wise, of course, India has got healthy systems way back, way back. Even 10,000 years back, India has got a health system. I mean, it is rumored that even something like surgery and others were done in India, because there are descriptions and there are actual written material, actual way things have seen. But let us not talk too much of the past, because past has got its own thing. We had a break for 800 years. So past was not properly communicated, properly, systematized in today's environment. So that is being rebuilt by the same health experts and into proper integration of today's. So now, as we know, physical health has got physical, mental, and it has got its own, and depending on what you are doing, how you are doing, why you are doing. If you have got a job which you have to sit, if you're a sportsman, it is different. If you're a doctor, you have to take care of the health in a different way. If you are a specialist in space, you have to take care of differently. If you are it does only doesn't differentiate a politician to a sportsman to a scientist to everybody has in a way the same, but everybody has got their own requirements which has to be taken care, which professionals will explain how they are doing, why they are doing. And in all this thing, there is something called social health, moral, spiritual health, and integration of various India's industry. As you know, Ayurveda and yoga, they all constitute in India. Ayurveda plus yoga is almost $90 billion industry in US alone. So we should know that, yes, we have to take care of that. We have to ensure that we do justice, because expectations are high, especially the COVID. Now, like Akram pointed out, you know, uh, India has become a pharma hub, which none of us would have thought of it 1 year back. We are also pharma companies were there. But today, the whole world is looking at India from development point of view, from manufacture point of view, from training point of view, and we have a leadership position. We can always say we are a superpower in pharma, and this particular word is being used by others in favor of India. And even our medical practitioners, with so many people, when they have got some bigger problem, previously it was like, oh, he had a bigger problem, so he went to USA for treatment. Today it is reverse. Of course, people do go to USA. By no means I'm saying we are competing with them. We are complementing them. We are working together with them, because health cannot be seen in any, you know, uh, in a very individual way. So, as I said, Ayurveda is something which India has contributed, and all the doctors today are very proud, and they do recommend, they do enhance their own skills, and many foreign doctors also come for studies. This is something like a SWOT analysis: strength, weakness, and opportunities and threats for this particular field, which also I will not go in detail. In all this thing, there is a doctrine called secured governance, which is what, proposed by me, so to say. Now, this is for a seamless, self-sustained growth of the economy, and health being a very, very large sector. Here we are promoting right from a nano hub, which is just an individual hospital, to a multiple, health-oriented cities, smart cities itself, to mini hubs, which is a system of many system put together, and this will be more of a self-sustained model. Otherwise, for everything, one looks for money and looks for money from government, and government doesn't have the money. So whatever it is, whatever government collects, almost 70% goes as its salary, and 30% of a total collection of 17 lakhs. You can understand what it is, and you need money which are all 2, 3 more zeros on the right side. So this secured governance comes as something which gives the money which is required because of the value valuation. Because value that is created, suppose you build a hospital, hospitals bring huge value around the hospital. The same building becomes one of the highest cost building. So in secured governance, when a hospital is built, it will take X number of FSI, and part of the FSI will be commercialized for permanent revenue basis. So which means that there's a permanent revenue generation by which poor people can be treated, by new instruments can be bought, by there's a continuous revenue which is there. And even around that, while planning itself, it'll take more land and keep on disposing the land with time. So that at higher and higher value, as the hospital becomes more and more famous, it has got more value around it. Those value brings huge capital into the thing. It's a very simple and crude way of describing secured governance for health system, and it is a lot more than what it is. So this is what is the picture of how a secured governance gives a positive way in which there's a value capture, the value realization. There is a way in which public private investment can this thing. And today, in the world, people are looking forward to India, so investments are absolutely nothing in the problem. So, with that brief, let me close today's my part of the thing, and let us go to our two experts. I will start with Dr. Natesh. Dr. Natesh is somebody who's had not only actual surgeon, he is also a very good management expert in for hospitals and all. He is the CEO of a group which is into a large number of hospitals throughout the world, and they are setting up hospitals on a capital basis, which means somebody else will invest on the land and building, and they will do. But he is not associated only with that. By himself, he's an expert on artificial intelligence for healthcare. He's also an expert on various very hardcore, very innovative way of health management, which I'm sure he will explain to us for a few minutes. Then Dr. Samir Shah, he has got his own purview, and he is finding ways in which globally India can play, and he can lead the role in having some systems by which he can have seamless expansion of healthcare. And he is doing it, of course, that portion he is doing it as an NGO, and as a professional, he is an hardcore surgeon in his own right. So now I'd first request Dr. Natesh, please have your first.
Thank you, Dr. Shekhar. Let me first of all thank you and Mr. Akram Haq for this opportunity. And I want to congratulate you, Dr. Shekhar, for the wonderful way in which you've been carrying out nation building. Some of the books which you've published, I've also had the good fortune to look at, and they're very, very insightful. And thank you very much for that. I also want to thank Dr. Samir, my other panelist here, for the wonderful work as doctors. Along with him, also to say a very brief thanks to all the healthcare workers in India who have been doing a wonderful job during the pandemic. Personally, I have lost a few of my friends to the pandemic, and I pray to God to bless the families, because they've done so selfless service that it's very hard to imagine that in this time of great stress and strife, we have seen true heroes in the healthcare fraternity, right? So with that, thank you for this opportunity once again, Dr. Shekhar and Mr. Akram. So basically, the digital transformation of healthcare, on which I want to give a brief overview about today, because it's a very, very, very broad topic, and it's very hard to encompass it, even within an hour or 2 hours. But to the best of my knowledge, let me give you a brief of what I think it means to the world and what I think it means to India, right? So a brief background about myself. I'm a medical doctor, like Dr. Shekhar said, but I've been very involved in tech for almost about 25 years. I've been involved in various techs like multimedia, right from the time 25 years ago when multimedia was introduced. We have done a lot of cutting edge work on CD-ROMs, on DVD-ROMs and all that. And we have published and marketed various titles on various topics around the world. So as continuation of that, I've done a lot of work on the AI, on medical robotics, and so on and so forth. So with that, so I will just get into a brief overview of what I think is very important going forward, and what are the technological innovations which are happening around the world. And I will come to a small bit about what is important for India in the Indian context, right? So as you all know, the pandemic taught us one very important thing, that not everything can be done face to face, right? So all the more now it's become important for healthcare companies and hospitals to completely change the way they think about delivering healthcare itself. It's not just about the way doctors practice. It's a way about how they are going to reach the healthcare. Earlier, it was very simple. A doctor came out, passed out, got some experience. He opened a nursing home or a hospital. More doctors joined it, and patients started coming, and then the hospital grew. It was very simple. 20 years back when we started, it was as simple as that. But now it is not like that. In fact, the last couple of years, I've been talking on a subject which is not been applied to healthcare. I think I'm the first to apply that. It's called VUCA. VUCA is volatile, uncertain, complex, and ambiguous environment, which is usually applied. It was applied in Iraq when the Americans went to war in Iraq. They applied a term called VUCA because they were not so unsure of what's happening. And later on in the early 2000s, businessmen started using it. When, during 2008, when the financial crisis rose, businessmen started using. But now I really think that applies to healthcare, because healthcare is now changing very rapidly throughout the world and in India. We're finding that the traditional model of coming to hospital, going back and treating people after they become sick is not really working out in the long run, especially India with such a large population. What I think going forward is that we need to find alternate ways of reaching. And unfortunately, as you all know, the medical coverage and the healthcare coverage in the rural areas in India is very, very poor. There hardly one doctor for about 75,000 people or more than that. And that is not at all acceptable, because you cannot have a national healthcare program without, reaching healthcare to all, right? But in India, the terrain challenges, the population challenges make it so difficult for us to, have that kind of a patient doctor ratio especially in rural areas. So one of the main ways, I think, one of the biggest innovations which has now come about due to the pandemic, it has actually gained importance, is telemedicine, right? I feel very strongly telemedicine is one of the ways we can definitely reach health to every corner of India. In fact, at a later stage, I've come to a personal program which we are working on, myself and a few other people who are very innovative, about a personal health monitoring system, which is done 80% is done online, and only 20% the patients need to come to the hospital. So we are now beginning to follow a hybrid model, which I think is the need of the future. And I'm very sure within the next couple of years, all this is going to become almost mainstream, right? So the important thing is that every doctor, every hospital owner thinks differently about this. It's not just about building a huge brick and mortar hospital and then hoping for patients to come is no longer going to work in the future, right? All throughout India, the healthcare models has to change into a hybrid model where, yes, you can have patients coming in, but you also have to have a model where healthcare is reaching patients wherever they are, at their office, at their work. And I think telemedicine is one of the best ways to do that, right? So I found, during our extensive work on AI and on telemedicine, we found that almost in certain, about 70% of interactions between the doctor and the patient can be done online, right? It's only 30% really needs to be done in the hospital. Emergencies have to come to hospital. Surgeries, surgical problems have to be treated in the hospital. But if you take dermatology, 90% can be done from wherever they are. They can be a consultation can be done from home or from the office. So why all this is becoming important? As we grow bigger, as cities become more congested, it's very tough to go for all working people. As women start working more and more, what happens is you can't just go for a simple dermatological consultation. You cannot travel 5 kilometers, 6 kilometers, because the traveling time is high, the waiting period is high, the coming back time is high, right? So you're using a lot of fuel on the way, you're wasting money on the way, you're wasting the hospital's time because you're just going in for a consultation. All this can be done online. All this can be, and it can be just as effective as a face-to-face consultation. I do agree about 5 to 10%, even something like dermatology can be done, has to be done offline, which is a face-to-face, but the rest 80 to 90%, I'm very sure can be done online, right? So these are some of the things I think are going to make a huge difference in the coming years. That is one. The second thing is, I'll talk about the importance of artificial intelligence. Now, what is artificial intelligence? Everybody thinks artificial intelligence is something the computer does by itself. It's not really that simple, It's just that artificial intelligence, simply put, is something the computer is able to do, which requires some level of human intelligence, right? That is what is called AI. So right now it's gaining, I'm sure you must have heard this term multiple times, but in healthcare, it's gaining a lot of importance because through AI, we are able to do so many things, which probably cuts down the need for healthcare workers in areas. For instance, you take radiology. I'm sure Dr. Samir Shroff has done a lot of work in this area. So if you go to villages in India, you will not find many radiologists, hardly any radiologists. So if an X-ray is taken, if an ultrasound has to be done, if a CT or MRI has to be taken, there are patients who have to wait for hours or even probably days in some instance for a radiologist to come and report that, right? But through AI, Google is doing a project where they were conclusively proved in a study over 100,000 MRI images that their AI engine was able to more accurately pick out breast cancer than the most advanced radiologists in the world. They tested it against 5 top radiologists in the oncology field, and they found that, wherever they said, a few instances where they said that it is not cancer, the AI engine from Google said it is cancer, and ultimately when they did the biopsy, they found it was, right? So that's the level where AI is actually reached now, and I'm sure. So these are some of the small instances where artificial intelligence is going to be very, very helpful for us, because I'm not going to say it's going to replace human beings. No, it's not going to do that, but it's going to definitely aid a country like India, where they cannot deploy radiologists in every nook and corner of the country, where every AI engine can be fitted on to the normal, the CT machine, the MRI machine, the ultrasound machine, and that itself will predict it to about 90-95% accuracy. It will give the diagnosis to the technician or the doctor who's there, right? We ourselves are I'm very happy to state that we are working with a large a motherhood clinic for predictive analytic Google AI engine for finding out fetal anomalies, right? In early pregnancies, fetal anomalies is very, very important to find. Otherwise, you end up with babies who are very, with with anomalies, and they're not unable to take care of themselves when they're growing up, right? But to find radiologists who are very experienced in fetal anomalies and then to deploy them around the country is not going to be very easy. The cities, yes, you do have a good number of them, but we are working on a project which, when it's completed and it's perfected, it can be the machine itself will be able to say, yes, there is an anomaly, even if the tonologist is not able to pick it up, right? So we are bringing it to areas where there are not enough high-end doctors available, so that the machine will play at least to 90-95%. It will be accurate in saying that there is something wrong here. Please go to the next level of investigation, and then they can follow it up. So that is how AI is going to help us very much, a lot going forward, right? So as an extension of this, we are working in Africa. We are working with a project about remote medicine, right? What is remote medicine? It's about, just like India, where there are villages where no doctor is available. I have designed a project. It's got a hub and spokes. So we have a central hub where we have all the facilities like CT, MRI, and we have cardiologists, neurologists in one hub, right? But in villages, you don't have, but we have just one unit where the nurse just puts a vest on to the patient, and all the data is transmitted to the central hub. Just give me one moment, sorry about that. So all the data is transmitted to the central hub, including the vitals, the card of the patient. Everything is transmitted within a minute. So, and through something called IOMT, which is Internet of Medical Things, you just need a nurse in the spoke, right, in the village. The small PHC will do, and the nurse has to just put the stat, and the cardiologist sitting in the hub can listen to exactly what's happening, and he can suggest medicines, right? So we designed a project, we designed a proposal and a project where about 100 villages are connected to one hub. So literally one cardiologist and one radiologist is handling 100 villages where there absolutely no primary care available earlier. So the remote medicine is now is probably the need of the hour in rural areas, and I think very shortly we'll be able to offer that in India as well. We are now experimenting with it in Africa, and we will be able to bring that. So as an extension again of that, right, in India, we now have what is called wearables. So, we are also again doing some work on wearables. We think very shortly we'll be there already. I'm sure there are a lot of wearables available in the market, but very shortly we'll be able to also offer our own. We're tying up with some companies to give, where the cardiologist is completely monitoring the pulse rate and the rhythm of the heart of patients also. So earlier, for this, an old senior citizen, maybe 80 plus, has to come to the hospital to get something called the Holter monitoring. But in this, it can be done remotely, and if at all anything goes wrong, an alarm is sent, and then with home care, we can get somebody to go home and sort out that. So these are the some of the things which are happening in the innovative medical innovation field all around the world. And as we speak, it's also happening in a big way in India. And I'm very happy to state that some of our companies are in an advanced stage of also being funded by a lot of companies. I'm sure a lot of funding is happening now in the healthcare startups, right? And India is one of the places where a lot of healthcare startups have come up, and very shortly, I'm sure that more and more healthcare startups are going to pick up and become very, very big companies in India and abroad. So there are a few more technologies like virtual reality, which is also coming up in a big way in India. We are doing some work with some companies about in virtual. I'm sure virtual reality is something which you wear on to your and then you can actually be in the environment. It's like a simulated environment, and we are trying to bring that for surgeons. Right now, surgeons, look at an image of a CT and MRI. So let's say it's a pancreatic tumor. It surrounds so many vessels, but they're only able to have a fair idea of what's happening. Only when they go in, they find that they're stuck to so many vessels. So what we are trying to do is build a complete virtual image of the patient's pancreas. And through virtual reality, if the doctor just puts on the glasses, he'll actually be able to go inside and see where and all the images, where and all the tumor is touching. So when he goes and operates, he knows exactly which is the vessels he has to avoid, which are the areas of the tumor he can take out. So it just allows them to have a much better visualization. And with virtual reality, the doctor can actually see where and all it is. He'll literally be inside the body. That's what it means, right? So it's a completely 3D environment, and it's so virtually simulated environment. So all these things are coming very, very soon. I'm not talking about something which is 10 years in the future. I'm talking about things which are happening in other parts of the world right now, and we are working very hard with people to bring all this to India. So virtual reality is definitely going to be something, the thing, and that for diagnostics in India. And also the same virtual reality is being used to treat psychological disorders. Patients, who suffer from anxiety, social anxiety, who suffer from a fear of talking. They're all use the glasses and they're put into social situations where there are a lot of people around, right? So as it's called graded exposure. And as they get exposed to these situations virtually, it's very simulated. They look around, they see people around, they see people like you and me walking around, talking. They simulate an environment in a train, in an aircraft. So all this helps to bring down the phobia, right? So all this is going to be the medicine of the future, right? This is all these innovations, the healthcare, the technology in innovation, innovative medicine is going to be the future, where I'm sure all of us are going to be, very, very involved in bringing more and more innovations like this to India. So I think I've taken about 15, 20 minutes now. I will hand over the mic to Dr. Samir, and after he finishes the presentation, I will come back and just take a few minutes and explain to you about CHIP, which is something which I'm personally developing along with my team. It's a CHIP is an acronym for Connected Health Informatics Platform, and I will tell you how CHIP is going to become very powerful in completely following a patient's personal health without his knowledge also. Of course, with his permission, but it will be doing it 24/7, and how CHIP is going to play a very important role in what I call personalized medicine, where we hope to pick up diseases even before they occur. Right? Over to you, Dr. Samir.
Thank you, Dr. Natesh. You have created a suspense for the second portion of your talk. Very nice.
Thank you, sir. Thanks.
Okay. Dr. Samir has got an excellent presentation, which, of course, I would like him to say a few minutes about himself and about what is he doing, and give the presentation. Dr. Samir.
That was a wonderful talk, Dr. Natesh, and I thank Dr. Shekhar for this opportunity, and also Dr. Akram from Policy Times. And I'm a practicing radiologist based in Pune, and I'm into specialized sonographies. I am into novel applications of sonography, especially to evolve cost-effective protocols which make a significant impact in terms of the disease outcome. So without wasting much time, I'll just come to my presentation. We all have faced the disaster that is called COVID pandemic, and I'll be discussing about the enhanced role for medical innovation and strategies for national reincarnation. I'll be discussing about medical innovation, especially those which are affordable, what is the necessity, and who are the stakeholders, and certain solutions which are out of the box. Affordable, frugal, or disruptive innovations. These terms have been heard very often by all of us. And what are these? These are global, cost-conscious, need-driven innovations to meet the needs in resource-poor settings without compromising the quality. And one of the contributions from our country is Jaipur food technology, which has been used by the individuals whose limbs are amputated, and low-cost infant warmers, which are used for babies. Any new drug, vaccine, diagnostic methods, drug delivery system, or mobile-based applications, devices, these are the subdomains as Dr. Shekhar had mentioned in his presentation. Affordability, accessibility, and well-creating innovations are important to tackle the healthcare challenges today, especially in the post-COVID era. What is the necessity? Rising cost of healthcare services was a problem earlier, and it has been further increased by the COVID pandemic. In the all the healthcare systems in the world, whether they are private or public systems, everybody is facing this problem of financial crunch. And uh, we must look at these statistics. The medical costs increased by 10% per year. 4% of GDP is spent on healthcare, especially in the developing countries, which is about 1 to 2%. And 70% of the spending is out of the pocket, and this is a huge burden on the systems, especially in public sector or on the individuals. And stakeholders are exploring innovative solutions, especially by focusing on prevention and promoting well-being. Who are the stakeholders? Who should get involved in these innovations or all these activities? Medical researchers, innovators, professionals, investors, especially from medical device and pharma industry. Also, health insurance sector could be a potential investor in future. I'll come to that point. Policymakers like Niti Aayog in India, health economists, ministries, various government agencies, advocacy groups, then venture philanthropists, voluntary organizations, and CSR companies could also play a very important role in this domain. Our finance minister has last year appealed to the CSR companies to support the innovations by increasing their spending through their budgets. Patients and individuals are also stakeholders, but they are not a market force per se. Now we will have a look at the medical device segment, and especially in India and similar developing countries. WHO report says that most medical devices in developing countries are designed for use in developed countries. These are unaffordable, maladapted to fit in the healthcare ecosystem. 80% of these devices are imported, and there is a great disparity in the supply of medical technology, which is depriving patients of life-saving diagnosis and therapy. So we should develop technology suitable for the system of the respective country. And just to have a look at the market share by various countries, America and Europe, has a market share of about 75%. Asia contributes to about 22%, and India is about 1%. Now, having discussed these issues, this major problem, there have been various traditional approaches and solutions being offered, but it is not giving us the desired outcome. And especially in the post-COVID era, we have to be looking at certain non-traditional solutions. So we have offered to form. This is I founded this forum which will function on a global scale, and this will promote health by undertaking all those necessary measures for existing, impending, and future challenges from time to time. And COVID pandemic is the biggest example. We could have taken certain better decisions on a global scale in this regard, and the situation could have been uh, perhaps better. This will involve business leaders, women experts, philanthropists, and policymakers, distinguished institutions, and also certain leaders which do not belong to the health segment. This forum will promote intersectoral approaches for health and life sciences, like pharma and biotech sectors as well, and pertinent issues like affordability, accessibility, and quality in healthcare will be focused upon. Another solution which we have suggested is to promote affordable innovations by creating a global IT platform, information technology platform, which would be round the clock, which will be interactive, and it will involve all the stakeholders from public, private, and voluntary sectors. Now, I'll just give an example how generally these innovations come up. Suppose in a country like ours, there is an innovator who has a project which is at conceptual level. Now, there is a high risk involved in investing from private sector. So this is generally, supported from the public sector. There is a great, list. There is a great effort being put on from the side of the government, from DST and various departments, and Apart from this, there would be a major, suggestion contribution coming from a non-profit sector or philanthropist, which will be of immense help to go on to a next level because innovators need grants, and generally it is risky for them to go with loans and undertake these high-risk projects. With a successful outcome, that is, for example, if a prototype is developed, a venture capitalist may play a role, and the project or this concept will go on to the next level. Even further, if the project is not able to attain the financial goals, a philanthropist or a voluntary sector may still be, continuing the support, and uh, the high social impact would be the outcome in this regard if the financial goals are unmet. Now, this model can help us to attain health outcomes as well as financial goals with a high social impact. And the risk is divided and shared by various sectors. And apart from which, the non-profit and government agencies could, support the corporate sector or the private sector and cut down the cost on marketing and other activities, creating a win-win situation. Now, it is very difficult for an innovator or an entrepreneur to run from pillar to post. So, we suggested a program to reach out to the innovators through this platform, which will, motivate them to submit the various proposals and ideas. We will create an idea bank or a repository, and which is will be accessible to all the stakeholders. And these domain-specific partners, future partners, would be connected for various purposes like funding, incubation, technological support, technological transfer, partnership, marketing, and other activities. We must be having an idea challenge program, not just happening once in a year or in some parts of the world only. We should be having idea challenge programs round the clock on a global scale, and almost every country's local regional health issues should be covered under this. And stakeholders should be posting a list of challenges. For example, during this pandemic, there have been various idea challenge programs, even it was run by our government, and for the purpose of diagnosis, prevention, and treatment of COVID-19 virus. Another example is Ebola virus, for which vaccine is available, but there is no treatment for it, and the mortality is very, very high, and it is very common in Central Africa. So, any problem in any part of the world could be, solved with solutions from any corner of the world. So we are trying to suggest another uh, solution in this regard because we have a lot of good premier institutions in the country, and we also need to have a center of excellence, rather a chain of center of excellence to promote wellness and in various sciences. Since I belong to imaging, I have just mentioned about this, wherein there will be integration of services, academics, and innovations. This center or a chain of these centers would promote evidence-based protocols and disseminate knowledge, especially focusing on prevention and early detection of a disease. Now, there would be a focus on cost reduction with a significant macroeconomic impact. Now, this is something which has to be a very important addition or a feature of these such centers. And we have also proposed, of course, we have been interacting with certain government agencies on this, to have innovation clubs in almost all the health establishments in the country, including teaching institutes, not just in medical colleges, but in every health establishment. Let it be a small hospital also, wherein these grassroots innovators can contribute the ideas and submit them on the IT platform, which I mentioned about. So, Center of Excellence and Innovation Club is could be of immense help. Now, I'll just give an example. What kind of impact such center can make? Diabetes mellitus is a very well-known disease. It's the fastest growing disease in this country. We have 40 million patients, about 4 crore patients with uncontrolled diabetes, and because of which it results in complications like kidney failure, ischemic heart disease, and it incurs a very high cost, treatment cost. Now we can monitor the injection areas. I think these are the injection areas, and with using sonography, so that we can select the normal or proper areas for injections and save the cost on insulin injections by about $3 to $4 billion annually. And of course, we can save the cost of complications. Of course, that's, we have not calculated as it. This will be a huge macroeconomic impact. Now, we have been using traditional approaches. Market forces are there. There are various market forces which are resulting in increasing the cost and complexity of the treatment. However, the health insurance sector is a dominant market force which needs to be roped in and utilized for this purpose. The problem is that high cost claim cost results in high premium, and this precludes or decreases the penetration of health insurance, and especially in developing countries. So, affordable innovations would reduce the cost of the treatment, and it will benefit the sector by reducing the claim cost and by increasing the penetration as the premium will go down. Of course, these companies have to maintain a claim premium ratio for their survival. Secondly, they can promote directly the innovations by providing grants, and CSR or corporate social responsibility grant could be a good solution to, or as a activity to begin with. They can promote centers of excellence, what I mentioned about, and directly promote the areas to bridge the gaps in the whole system. And idea challenge programs could be coined and suggested, rather they should be suggested by health insurance sector, wherein they are incurring very high cost in terms of treatment, especially those companies which are having cancer insurance or similar products. Now, just what will be the impact, especially in a country like America? Suppose we cut down the cost by 10%. Since the insurance spending in America is about $2.5 trillion annually, if the cost cutting is done by, if there is a reduction in the cost by 10%, due to affordable innovations, it may save about $250 billion annually. Of course, this is the it's very difficult to get this kind of an impact to begin with. Maybe even if it is 1%, still we can save about $25 billion annually. So just to summarize, innovation plays a greater role in reduce the cost of service or a product, making healthcare simple and affordable. It can also create wealth on the other hand, especially the public sector, healthcare system in different parts of the world, including our country, can support service and academic domain through cross subsidization. What is happening today that we have been burdening, especially in private sector, on the service domain, wherein the revenue, that is the only revenue generating activity. So if we can create wealth through research and development or innovations, it may cross subsidize the services, also the medical education. Now, IT platform, as we discussed, and a global life sciences and healthcare forum could be of immense help since it will be acting on a global scale. Now, health insurance sector should be a major catalyst, and they can play an important role as a major market force. And we need to have a chain of center of excellence for diagnostics, wellness, and imaging and other disorders. Considering its macroeconomic impact, this should be priority in different regions of the country. Now there are various public sector schemes which government has been running since many years, and especially for the tertiary care. There is a public health insurance scheme called Ayushman Bharat. Now we can, come up with a better sustainability of this particular program, as there would be wealth creation and cost stabilization going hand in hand. Lastly, we can promote India as a low-cost manufacturing hub, since we have a vast pool of talented innovators in this country. So thereby we can promote Make in India and Atmanirbhar Bharat. This is the agenda which is being declared recently. So affordable healthcare innovation in India, catalyzed by health insurance sector, strategy for national reincarnation for post-COVID era, would be a message I would like to give. This would promote Make in India. We can do it here, we can manufacture here and export, and we can make our ideas implement on a global scale. And I thank you for your patient hearing. I again thank Dr. Shekhar and Dr. Akram Haq for this opportunity. Thanks a lot.
Thank you, Dr. Samir. so nice that your global healthcare and life science forum. I'm sure you're getting a real blueprint for the way things have to go, and I hope your thing takes really the global forum and take advantage of these type of web summits, webinars, and to make it really happen because there's a need of the hour. Now, coming back to Dr. Natesh had created a suspense of his actual venture for seeing how you could even predict without a horoscope in terms of what will happen to your body and through a fully scientific methodology. Dr. Natesh, you
Yes,
could
yes,
have your
yeah,
second
yeah, yeah.
part.
Hello again. So, Dr. Samir, thank you, and I applaud you for such a wonderful presentation and for all the great work that you're doing in that field.
Thanks, sir.
Thank you so much. Yeah. So, as I was talking earlier, one of the projects which I'm personally managing and spearheading is called CHIP. CHIP is an acronym for what I call the Connected Health Informatics Platform, whereby imagine if I ask all of you, do you have your medical records for the past 10 years? No, I'm sure I don't have. I'm sure it's there somewhere, but I don't know where, X-rays, ultrasounds, or whatever I've taken, right? So what we have actually done with CHIP is the first thing we are doing is when a user logs on to CHIP and enrolls on CHIP, the first thing we do is we get all their medical data in one place, right? Let it be their discharge summaries, let it be their X-ray films, imaging, their ultrasounds, the MRIs, the CTs, everything. It's like a digital health wallet for the individual. So that is the first thing we're offering in CHIP. Now, the reason why we're doing it this, uh, CHIP is being offered right now as a B2B venture. We are doing it for employees of corporations, right? Because corporates are finding it. They approached us and they say, because as part of the group I'm working, Lifeline out of Chennai, we handle numerous corporates where we have on-site centers also. But many of them say that, we keep transferring our people around our corporates from Chennai to Delhi or sometimes to the US, and all the medical records, they don't know where it is, right? So what we decided to do was we said we will deploy CHIP in the company. And the first deployment, I'm very happy to say that we're deploying it in the 15th of this month in one corporate of 2,000 employees at Chennai. And thereafter, we're going to deploy it around India. So the first thing, there is a digital wallet where once you enter it for lifelong, it's yours. It will be there. So it doesn't matter which part of the world you're in. It complies to what is called the HIPAA, the HL7, and on the GDPR of UK. Any country's regulations, all the standards of storing data are followed. So once you enroll onto CHIP, your data is there for life. All your medical data is stored in one place, and it's stored in chronological order, right? So if whichever part of the world or in India, you go and get your medicals done, all you need to do is upload it onto CHIP. And CHIP, the user-facing application of CHIP will be on an app. So it's just on a mobile phone. If you can't scan the report, just take a photo and put it in. That's all. And CHIP will store it, convert it in the format, and keep it for safe custody. And the very, very interesting and very important thing here we are doing is this, what we call consent-based privacy. This is very important outside India, but in India, people really don't understand the importance of the medical data. And we are strong believers in the concept that our medical data is our property and it doesn't belong to anyone else. So the entire thing, we are going to lock it, and the health wallet is actually encrypted from end to end, and it is encrypted with blockchain technology so that it's virtually unhackable, right? It works on the same policy as the crypto coins, right? Bitcoins and stuff like that. So it will completely be virtually unhackable. And suppose I'm traveling to the US and there's an emergency, and I can give 1 day's consent for the doctors to view the data, right? So we're putting the consent completely in the hands of the user of the data. So that is the first thing which CHIP does, right? Going forward. So now, one of the main reasons why I wanted to develop CHIP was we do health checkups from numerous employees in corporates. But what is happening is that the 1 year we do, our doctors prescribe something, till the next year, we don't know what's happening to the person, right? So with CHIP, it has a very, very intuitive chatbot engine. It's an AI-based chatbot engine. If at all something happens, even in the middle of the night, you can literally start chatting with the bot. and you can say, I have pain in my stomach. It will give you a quadrant where you can say where the pain, where is the pain. You can touch it. So basically our chatbot, which is an AI, will keep on learning from all these experiences. Like for instance, just an example of how an AI chatbot works. If you say I'm feeling blue, right? No system will literally understand, because it's a very natural language, right? When we say we are feeling, it's a colloquial thing for saying I'm not well. But now AI will start understanding and say, what is wrong with your health? It understands that it's not the color blue you're talking about. It understands that you're not feeling well today, right? So that is the level to which our AI chatbot is going to interact with you. So imagine this thing, day or night, whichever part of India they are, even in a village, if they have access to connectivity, they can go on to, when they come on to chip, you can chat with the chatbot, and immediately if there's an emergency, there's a telemedicine button and they can instantly talk to our doctors, right? So day or night, 24/7, they are instantly connected to our doctors. And very funnily, as they keep talking, the AI chatbot learns more and more. So till at one time, it also starts giving, of course, we are about 1 or 2 years away from that, but it starts giving a diagnosis also, right? It could be this. So that's the level where we're going. And the last point, what I'd say about chip, there are many more features, but for lack of time, predictive analysis is what I want to talk. One of Chip's very important features. A very important person from a big company in India. He was about 41. He was a marathon runner. His health checks were completely normal, but one day when he was on the treadmill, he just dropped dead. 41 years, a marathon runner. So there was something wrong, which all his yearly health checkups missed. So I feel strongly that something in his genetic makeup. So we are introducing genomics into chip, and we're making it very low cost, just at the cost of a normal health checkup, where we can pick up very, very rare mutations, and we will be able to tell you that this mutation is there. So you need to take care, even though all your health checkups are all right, you need to take care. And with certain wearables we are introducing, we will be able to personally monitor the health of the patient, their heart rate, their oxygen. For instance, when we find a drop, we will call him, even if the patient, even if the user doesn't know, we'll be able to call him and say, there's something wrong, come and meet us, or go and see the nearest doctor. So that is the level with which we are envisaging chip. Of course, we are in the process. We're starting version 1 this month, but I'm sure as we go on, you will be hearing the name of chip more and more, right? So with this, I would like to close this, and thank you once again for this opportunity, Dr. Sheikh.
Thank you so much. So nice to see that something really great is happening, and that is what is the expectation of the world. I'll have a few more minutes with Samir before I conclude.
Right.
Dr. Samir, you could now elaborate on your real future plan and what sort of comfort level is brought to the end user from your global foundation, which you're trying to evolve. Dr. Samir.
So, as I mentioned about all these activities, it is a need of time that we really become a global village in true sense, using the cutting edge technology. And again, I just forgot to mention that there will be a lot of automation used in these projects, so that as Dr. Natesh mentioned about AI chatbox and other features in his venture. Here also we'll be using a lot of automations to connect people on a global scale, so that the best of the people can connect, and they can take their ventures or ideas or projects onto a next level, so that the impact would be multifold in coming time. And I'm in the process to raise a center of excellence myself, secondly this IT platform, and excellence. Apart from this example of diabetes mellitus, there would be many of such disorders, and most of this knowledge is generated in different parts of the world. So we need to have certain protocols when we apply in Indian scenario. And even there are these simple protocols which we can utilize and make a significant impact at micro and both at a macroeconomic level as well. So I'm just trying my best to take these ventures on to the next step.
Thank you. So with this particular comments and remarks from both of you, I would generally summarize what we are trying to say. Yes, there has been a problem, but at the same time, for this, we are in safe hands in the Indian doctors. Indian doctors are medical professionals, so to say, along with the supporting fact of the government itself, of the pharmaceutical industry, of the Ayurvedic industry, which is decoupled and coupled to the medical fraternity, which was totally away. Now it is coupled. yoga, and so many other systems, along with the latest. We cannot just simply keep being proud of our own past. We have to take today's things into account. Even when we say artificial intelligence, today most of the experts in the world are Indians. So we need not have to feel as if we are taking something from abroad. At the same time, it is time to give, because we as Indians are there to give to the world. And there's a huge expectations of the world from India. Europe is looking at India in a big way. America is already hugely doing their own vice president being something like a semi-Indian. So there is, even in China, people may or may not know, a lot of their systems come from India. Even one of the best medical treatments is coming from an Indian who defected to China, who went to China, not defected, so to say. And, so that way we are there. But we have a huge, and from knowing from Dr. Natesh and Dr. Samir, in terms of the new development which we are doing, we are really proud of all of you. And we really hope that all of you will take it not from the Indian level, but from the world expectancy on a global level. With that, I will conclude today's session, and Akram can say the final vote of thanks.
Thank you so much, Dr. Shekhar and Dr. Samir, Dr. Natesh. Wonderful to hear you. Wonderful, actually, the way Dr. Samir presented the entire presentation, and also seeing what Dr. Natesh is doing in terms of bringing technology and innovation. It's really needed, much needed, and I think it will transform. The first point that I got, the impression I got, is that yes, there are age-old challenges in Indian healthcare system, also in the global healthcare systems. Every country has its own challenges in terms of making its healthcare accessible for all, at the same time affordable for all. That's the motto. Now India is still far better off. In America, people go bankrupt because of the health issues. The same thing also in India in terms of for the elite society. For example, those who wants to have a better lifestyle, they can't go to the government hospitals. They have to go to the private hospitals like Max or Apollo or these ones. But then they also make them bankrupt. So the model that we need to adapt is, how do we make our healthcare affordable, at the same time accessible for all, whether they are rich, they are poor, it doesn't matter. I have seen many Indian NRIs in America. They came back to India because of their parents' treatments, because they can't afford their treatment in America. But it is very much affordable in a country like India. So what I mean to say, the first thing I want to say, that artificial intelligence, I think, can solve the problem that we face, India is facing, making it accessible and affordable for all. The second important point, what I want to say, that when uh, this Israeli Prime Minister came to India and we were hosting him in India, he said that we are collecting the DNA samples of every Israeli citizen, and from the DNA we are building an ecosystem that we will find out at his 5th or 6th year of age, that when he will have diabetes, whether it is at the age of 60 or 50, or what is the probability of having cancer or diabetes or all this kind of chronic diseases, and how do we solve the problem at the age of 5, 6, 7. So that's the kind of medical innovation and medical advancement that is possible by any country. There is no limit to it. Second thing, we just produce 50 to 70,000 doctors, MBBS doctors per year. Though we have reached to a very comfortable level, I want to speak in Hindi actually. तो हमारे देश में हालांकि वो बहुत अच्छे कंफर्टेबल लेवल में आ गए हैं, वो बोल देते हैं डॉक्टर टू पेशेंट रेशियो 1000 होना चाहिए, ये आ गया है यूनाइटेड नेशन के पैरामीटर से, लेकिन आधा से भी ज्यादा 70% डॉक्टर जो है वो शहर में रहते हैं, अर्बन एरिया में रहते हैं. तो गांव का जो बड़ा एक तबका है उनको हेल्थ केयर नहीं मिलती, और वो लोग कंप्लीटली गवर्नमेंट हॉस्पिटल पे डिपेंडेंट रहते हैं, और कुछ 2-4 प्राइवेट हॉस्पिटल्स और नर्सिंग होम्स होते हैं which are naturally not sufficient. मेरा एक मानना है कि we need to produce massive doctors. कहाँ 135 करोड़ की आबादी है और सिर्फ 70,000 डॉक्टर हम इंडिया में पैदा करते हैं, जो एक शर्मनाक एक्चुअली फिगर है. कम से कम 7 लाख डॉक्टर पर ईयर होना चाहिए. But doctors will have different opinion. बट एज ए पॉलिसी एनालिस्ट मैं तो हमेशा ये सोचता हूँ कि हमें मिनिमम 5 से 7 लाख डॉक्टर पर साल होनी चाहिए, प्रोड्यूस करनी चाहिए। पिछले कुछ सालों में हम फार्मा कैपिटल बन गए और वो मेडिकल हब बन गए, हमारे डॉक्टर्स बहुत ही ज्यादा सुपर स्पेशलिस्ट और प्रोफेशनल्स हैं। वेलनेस में हमने काफी अच्छा तरक्की कर ली, तो फार्मा के बाद, मेडिकल के बाद वेलनेस एरा में वी आर द नंबर 1, चाहे वो बाबा रामदेव के वो कुछ ये हो, पतंजलि के हो, या श्री श्री रविशंकर के हो, बट और जीवा के बात करूं, ये जो कंपनी इमर्ज कर रही है, देयर इज मैसिव डिमांड अक्रॉस द वर्ल्ड। इसके साथ अगर प्रिवेंटिव हेल्थ केयर वाले, वेलनेस और प्रिवेंटिव कहने की थोड़ा बहुत कनेक्टेड है, अगर हम एक प्रिवेंटिव हेल्थ केयर सिस्टम को बूस्ट करें और इतना मैसिवली एग्रेसिव बनाएं, आई थिंक वी विल नीड देन लेस डॉक्टर्स एंड लेस थिंग्स। तो ओवरऑल आई थिंक द पॉइंट्स दैट केम फ्रॉम द डिस्कशन इज एब्सोल्युटली रिलेवेंट। तो व्यूअर्स, आज का शो यहाँ तक था, और अगर हमारा ये शो आपको पसंद आता है तो जरूर सब्सक्राइब करें। हमारा एक ही कमिटमेंट है दैट हमारे लाइफ टाइम में we want to make India one of the most prosperous nations. It has a lot of gifts, but it also needs to meet a lot of challenges that it faces. The challenges is not for the rich, but the bottom of the country, or the rural area that people are living. जब हर citizen, जरूरी नहीं है सबके पास पैसा हो, लेकिन हेल्थ केयर और मेडिकल अगर हम सबके लिए अफोर्डेबल और एक्सेसिबल बनाएं, तो हम दुनिया के सबसे एक बेहतरीन मुल्कों से एक बन सकते हैं। भूटान के पास बहुत ज्यादा पैसा नहीं है, लेकिन भूटान दुनिया के सुखी देशों में नंबर 1 रैंक करती है। तो हमें जरूरी नहीं है हमें अमेरिका बनना है, ना ही हमें चाइना बनना है, और ना ही हो सकता है हमें भूटान बनना है। हम इनसे भी कुछ अलग और यूनिक बन सकते हैं, और यही पॉलिसी टाइम्स की मिशन है। आप देख रहे थे